Let's discuss Yin-Yang theory, the applicable examples in TCM Part 2. For the excess of Yang leads to heat and result in yin disease. It refers to the pathogen going beyond the physiological limit and reaching the absolute exuberance degree, all of which belongs to the excess of Yang. Due to the nature and pathogenic character of Yang pathogen, that is excessive heat, excessive Yang results in heat. Predominance of Yang often consumes yin fluid within the body and leads to pathological deficiency of yin fluid. Therefore, there is a saying, predominance of Yang makes yin suffer. For the excessive yin leads to cold and results in Yang disease. It refers to the pathogen going beyond the physiological limit and reaching an absolute exuberance degree, all which belongs to excessive yin. Due to nature and pathogenic character of yin pathogen, that is excessive cold, the predominance of yin often damages Yang qi within the body and leads to the pathological deficiency of Yang qi. Therefore, there is a saying, predominance of yin makes Yang suffer. For the deficiency of yin or Yang, this refers to the pathological change of either yin or Yang going beyond the normal level. Generally speaking, deficiency refers to Yang qi or yin fluid that is the same as the vital qi. The pathological changes generally have the following categories. Letter A, deficiency of Yang. Yang deficiency leads to cold. It refers to Yang qi deficiency and is characterized by its decreasing ability to move and warm the system. On the other hand, Yang qi deficiency causes the body to be easily attacked by cold pathogen. Therefore, there is a saying, Yang deficiency leads to cold. Letter B, deficiency of yin. Yin deficiency leads to heat. It refers to the fluid deficiency and is characterized by its decreasing ability to nourish and moisten the system. On the other hand, yin deficiency cannot restrict Yang qi and resist Yang pathogen. Therefore, there is a saying, yin deficiency leads to heat. Letter C, mutual damage of yin and yang. It is a pathological manifestation of what damage of yin and yang. Yin and yang are mutually connected and rooted with each other. If one side is damaged, the other side will be affected. When yang qi or yin fluid gets damaged, it will result in the deficiency of either side and cause a pathological change of the system. When the yang deficiency reaches to a certain degree, it cannot transform or generate yin fluid, which result in symptoms of yin deficiency, which is called damage of yang affects yin. Vice versa, when yin deficiency reaches to a certain degree, it cannot nourish or moisten yang qi, which result in deficiency of yang qi. This is called damage of yin. Damage of yin affects yang. Both types will lead to deficiency in both yin and yang eventually. Letter D, to guide and diagnostic application, yin-yang diagnosis based on color and luster of the skin. Brighter color pertains to yang, while a darker and gloomy color to yin. Yin-yang diagnosis based on sound of voice and breathing, higher tone, talkativeness, and restlessness pertain to yang, while a low and feeble voice, reticence, and speechlessness to yin. Rough breathing pertains to yang, while shallow breathing to yin. Yin-yang diagnosis based on pulse. From the position of the pulse, tune pertains to yang, while qi pertains to yin. From the pulse rates, rapid beats pertains to yang, and slower ones pertains to yin. And from the shape of the pulse, the floating, rapid, excessive, slippery, and big pulses pertains to yang, while deep, slow, thin, small, and deficient pulses pertains to yin. In diagnosis, the accurate distinguishing of yin and yang is the key to master the root of the disease. 8 principles are the fundamental diagnostic method. Among the 8 principles, external, excessive, and heat syndromes pertain to yang, while internal, deficient, and cold syndromes to yin. To guide the application to the treatment, the basic therapeutic principles of the traditional Chinese medicine are to maintain the balance of yin and yang, reduce the excess, and reinforce the deficiency. The application of yin-yang theory to guide treatment of disease is mainly to determine the therapeutic principle and to summarize the medicinal property. To determine the therapeutic principle for excess of yin and yang, it refers to the excess of yin or yang. It is a case of surplus. When the excessive yin or yang has not caused the deficiency of the opposite party, it belongs to the simple excessive case. The therapeutic principle is to sedate the excess. For example, excessive yang causes heat, and the cooling or cold herbs should be applied to restrict the yang and expel the heat. Vice versa, the warm herbs should be applied to restrict yin and expel cold. The therapeutic principle for deficiency of yin, yang. It refers to the deficiency of yin or yang. Therapeutic principle is to tonify the deficiency. Deficiency of yin often results in the inability of yang restriction that causes the yin deficient syndromes. In this case, it is better not to use the cool, cold herbs to expel the heat directly. Instead, the principle of nourishing yin and replenishing water should be applied. By nourishing yin, heat due to the hyperactive yang will be restricted. In the case of deficiency cold pattern due to excess of yin caused by the failure of deficient yang to check yin, to dispersing medicine of acrid and warm nature should be taken to dispel its coldness. But a method of yang supporting and fire supplementing to expel the excessive yin should be applied. According to the theory of interdependence of yin and yang, the methods of seeking yang from yin and seeking yin from yang may also be considered in the treatment of deficiency of yin or yang. When using yang warming herbs, by adding the yin nourishing herbs as the subsidiary, it is called seeking yang from yin. When using yin nourishing herbs, by adding the yang supplementing herbs as the subsidiary, it is called seeking yin from yang. Thank you for your attention.